Next, in our program, we're going to have two presenters, Katie Scollon, who is Director of Heart and Vascular Services here at the Heart Institute at Children's Hospital of Pittsburgh, and also Erin Colvin, who is a APP Supervisor at the Heart Institute, and they'll be talking about the patient experience in Pittsburgh.
Thank you, Dr. Kreitzer, for that kind introduction. Erin and I also want to thank the course directors for the invitation to speak. We're excited today to talk about some of the operational details of the De Silva Center and how we get these patients to Pittsburgh. First, just wanted to recap the history of the creation of the De Silva Center. And it all started in 2016 with the recruitment of Dr. Jose De Silva to UPMC Children's Hospital in Pittsburgh. Dr. Luciana de Fonseca De Silva joined in 2019, and we hosted our very first international De Silva Center and Symposium in 2021. This all led to our current state, and Erin and I are really going to focus on our current state, or where we are as a program. As you can see, we do get a lot of referrals into the program for review of Ebstein anomaly cases. We also do a large number of cone surgical cases a year. Many weeks throughout the year, the OR is doing several cones in the week. The OR team now fondly refers to this as the Conapalooza weeks. We also receive referrals from a large, broad age demographic. We have fetal referrals coming, pediatric referrals, and the adult congenital referrals. The age demographic chart you see up there is specifically for our cone procedures. And here across the country in the US, each one of these dots represents a cone patient that has traveled to Pittsburgh for surgery. So we have over 50 cases from 2023 until current, coming from all over. We've also done 20 international cases from 2023 until present. And when we look at this broad patient demographic population, we really need to think about what is the patient looking for when they refer either themselves or are referring pediatric cardiologists into Pittsburgh. Obviously, number one is the clinical expertise. They are looking to come to Pittsburgh for the surgical expertise and the multidisciplinary care that we offer. Erin is going to talk significantly about that clinical vetting process. But they also want to understand what's their insurance coverage here in Pittsburgh and what's their financial responsibility if they come for care. What resources do we have to assist with travel and housing? Do we have interpretation services available? What's the communication like from our team to their referring doctors? And if they do come to Pittsburgh for intervention, what does it look like for them when they leave? So we established some operational goals of the De Silva Center, and the first one was, overarching goal is we want to ensure access to the clinical expertise that's available to all patients with Ebstein's anomaly. We want to accommodate the volume growth that's coming. We want to address the financial challenges for the patients and the families, recognize the unique clinical and psychosocial needs of the patients based on age and demographic, and address the internal and external communication challenges that occur. Really focusing, I'm going to focus on number 3 and 4, and Erin is going to talk through the clinical aspect, but we want to make sure that number 1 remains the priority for the patients and the clinical team. So to address the insurance or financial challenges that may occur, we have a very close partnership with the Children's Hospital of Pittsburgh's financial team. When we receive a referral in, we look immediately into what's their insurance state. If we need to evaluate out-of-state MA agreements, if we need to engage to become par with a certain out-of-state MA, our institution is willing to do that. We also, several times a year, create single case agreements to make these cases happen here in Pittsburgh. Our finance team has also developed a very competitive self-pay rate for our international community. This is evaluated on an annual basis to make sure it remains comprehensive, but also very competitive. So that is one of the components, the clinical evaluation's happening, but this is also happening in tandem when the referrals come in. We also recognize that there's other financial gaps that exist for the patients, and we don't want those to be a limiting factor on getting them to Pittsburgh. So when the referral's made, we also do a social work intake, so we can identify what are their housing needs, what are their transportation needs, is food insecurity an issue? All of those are identified when the referral is made by our team. And we ensure that we're communicating to the patients and the families what resources we have available. Our Ronald McDonald House is adjacent and connected to our hospital. We have a partnership with Southwest Airlines where we can offer tickets. Our Children's Foundation partnership is very strong, and they support a lot of the travel for this program. We also have external partnerships with programs such as Ebstein Traveling Hearts, which really help in aiding that. Again, we want the primary focus to be on the clinical needs of the patients and these other factors to really be facilitated. So I will pass this off to Erin now to talk about that clinical aspect.
Hi, everybody. Thanks, Katie. So one thing that we just, and I think it shows from the beginning, is that we really do have a multidisciplinary team approach. And we're still, we're still making changes, and we're still tightening things up as we learn new things during, each patient that comes in. So we initially would get a referral. It could be from an outside cardiologist, and it could be from a parent. I would say we probably are about 50-50 with the amount of times a family is reaching out and a cardiologist is reaching out for this year. I think in the past it had been a lot of families reaching out, but I feel like now that we're developing relationships with outside cardiologists, it's happening more and more. And so we go through an initial, we have a very nice list of what we need to be able to do an initial review. We try to make it as easy as possible, not only for the outside cardiology team, but also the parents, by our team getting those records, making sure we have everything. With the online medical record systems, a lot of times we're connected and can see a lot of that, but we definitely want to make sure we have all the images and records that are available. And our team then, we actually have a multidisciplinary meeting but twice, 2 to 3 times a month, depending on how many patients we have. And during that meeting, we are independently looking at the echocardiograms, the MRIs, the Holter, the EKG, and all the clinical data, and making our recommendations or a comprehensive treatment plan for each of the patients. Some of these patients are newly diagnosed Ebstein's as an adult and may not need surgery, but just want our opinion, want to know, are we doing the right thing for this patient? So some of them, our treatment plans will be surgery. Some of them, our treatment plans will be watch, and here's the follow-up recommendations that we are thinking we want to do. And then there's also the multidisciplinary piece of when they come, if they do come to Pittsburgh for treatment, that evaluation of what happens in Pittsburgh and the treatment that's going along when they're here. And then the follow-up clinical care, including the ongoing consultation with their local cardiology team and the team in Pittsburgh. So who is our team? So our team is made up of a whole bunch of people that are very dedicated to the care of our patients with Ebstein's anomaly. That includes our cardiothoracic surgeons, obviously, and our interventional cardiology team. We have our electrophysiologists, cross-sectional imagers, our fetal cardiologists, adult congenital cardiology, and then also our acute care cardiology team, who is going to be taking care of these patients when they're in the hospital. So I talked a little bit before that. So the referrals initiated, like I said, can be an outside cardiologist, can be a family. We also, international referrals, as Katie mentioned, we have an amazing international team that actually kind of works side by side with our Heart Institute referral team. So if it's an international, they will collect the records and bring those to our team for review. If it's a patient in the U.S., our referral coordinator will assist with coordinating and getting all the available images. We try not to have the families have to do that. Sometimes we have to have their help, but we try to make it as easy as possible for them. And if able, because sometimes if an outside cardiologist is making the referral, we won't talk to the family right away, but we will give that outside cardiologist the information about how the process works, so they know this is what we do. We are, independently looking at all the images and all the records that we have, and we're making those decisions based on that. And also that this doesn't cost the families anything. So whether it's the family reaching out or the cardiologist reaching out, this doesn't cost the families anything. The only reason we ask for insurance information up front is so we can vet that a little bit to make sure that if they do need care, that we can that we have enough time to make sure that we can get the insurance to cover. And if we do talk to the families, we do like to, you get an assessment of their psychosocial needs, what they need. Do they want to come here but they feel they can't because there's barriers, like they can't afford to travel or they can't afford to stay here while they're here. So we just want to be very upfront with them and understand their needs so that we can support those. So how do we make that clinical treatment plan and recommendations? So like I said, we have a multidisciplinary meeting, and at that meeting, we are looking at all the imaging and all of the data that we have. And with that, we make our comprehensive treatment plan. And that could mean further diagnostic testing. Okay, this patient hasn't had a Holter. There's no pre-excitation on the EKG, but we need a Holter to fully evaluate whether they need an EP study or not. It may be that, okay, the patient meets criteria for a cone, but we need an EP study, we need an MRI prior, and that would be our recommendations. Or it may be, this patient is doing okay right now, let's follow up in a year with an MRI or echo or whatnot. And if an intervention is proposed, we would also give them the timeline. So, within 3 to 6 months, some of these are a little sooner depending on what's going on with the patient. Recommendations are discussed with the patient and family. Obviously, if it's the outside cardiologist, they get a letter, we talk to them, we make that connection, and we try to make that connection not just via email or fax. We want to develop those relationships so that they can understand. And I will say most people that are referring patients to us, they want that connection too because they want to learn and they want to make sure that they're doing right by their patients and families. We also would offer at this point a virtual call with the De Silvas. If it's a fetal patient, oftentimes Dr. Weinberg will do that fetal call with our fetal nurse coordinator, who also works with our Ebstein's team, in conjunction with the De Silvas. So the team here is just very invested in making sure the families, get all the information and truly understand it. And the other piece, when this is all happening, if we're recommending a cone and we're recommending whatever we're recommending, we have a lot of educational materials that'll get sent to the families as well, so they can have something to look at and to read, and they have our information if they have questions after as well. So then what happens? They decide we're going to come to Pittsburgh and have this intervention, this surgery, whether it's a cone or if it's a, Starnes takedown and a cone. The referral liaison and social worker will work with the family to arrange transportation and housing as needed. Like Katie said, we use our Ronald McDonald House. We have a place called Family House, which is close, that we also utilize if Ronald McDonald isn't available. Our airline tickets, we have transportation for the families from the airport to the Ronald McDonald House or the hotel. Our goal with all of this is to make this as easy as possible for the families. And we often use Ebstein's Traveling Hearts, which is a nonprofit organization that supports families traveling for congenital heart disease surgery, and they have been amazing in helping. There are different air ambulance kind of companies that actually are nonprofits that will donate flight time or a seat on a plane to get a patient here, and we've used those before. Our goal is to take that financial concern out of there for the families. Like, I don't ever want a family saying, I can't pay for an airline ticket to come to Pittsburgh to have this life-changing surgery for my kid. And I think our foundation and our Heart Institute, everybody is 100% on board with that. And I think it's just life-changing for these families. And then when the patient comes to Pittsburgh, when we make our recommendations, I will say that, say we're recommending EP study and MRI. Some families elect to get that done locally, and some want to come here. It kind of varies. I think we try to talk to their primary cardiologist too to see like what their thoughts are on it, and sometimes they feel let's just do everything here. But we make sure that when we bring the patient here that we have another review of everything to make sure that the patient, we don't have any other questions. And that review also would include our cardiac intensivist, our anesthesia team. So that's at our bigger cardiology Heart Institute conference where everybody's there so we can really make sure we're not missing anything for the patient. And then post-procedure, the multidisciplinary team approach is continued throughout the hospitalization, throughout, the team is involved, they're making recommendations, we have protocols and different things in place to kind of streamline care, and it's been an amazing journey over the past few years to be able to really do that. And also the direct communication with the primary cardiologist, I think that is really key in keeping them in the loop. From the beginning, the De Silvas will call them usually the day of surgery, maybe the day after, just to let them know how their patient did, because these families, everybody is so invested in these patients and all their patients, so it's nice to hear. And then developing that follow-up plan to ensure continuity of care once they go home. Usually we have them, once they're discharged from the hospital, they stay in Pittsburgh for about a week. As long as everything's good, they come back and see us once with an echo and just assuring that things look good, and then release them to go home, making sure that all that communication and all those images are getting back to the cardiologist. And then at different intervals, getting that data back from the cardiologist. I think what we're finding now is, as our program grows, we're getting more cardiologists reaching back out at 6 months, a year to say, hey, can your team evaluate these images and let us know what you think? And it's been a great, I think some of it's still, I think we still have some ways to kind of clean that up, especially with our international patients. But it's an ongoing process, and I'm excited for where we are now. And that's the end. The 2 email addresses up here for domestic referrals, you can email the De Silva Center at upmc.edu, and international, it's international@upmc.edu. That goes to an email that's checked every day, and we can, like I said, reach out if questions, even if you think your patient's okay and they want just us to look at the stuff, we're happy to do that. And that's our goal, is really just to touch as many patients as we can with Ebstein so we know that they're getting the best care. So thank you.